Is the next pandemic going to be triggered by bird flu? And could it come sooner than we think? Scientists tracking the spread of bird flu are increasingly concerned that gaps in surveillance may keep them several steps behind a new pandemic. Many of them have been monitoring the new subtype of H5N1 avian flu in migratory birds since 2020. But the spread of the virus to at least 129 dairy herds in 12 US states signals a change that could bring it closer to becoming transmissible between humans. Infections have also been found in other mammals, from alpacas to house cats. Scott Hensley, a professor of microbiology at the University of Pennsylvania, has said, "It almost seems like a pandemic is unfolding in slow motion. Right now, the threat is pretty low, but that could change in a heartbeat." And then there are warnings from certain other scientists that are much more stark and alarming. The next pandemic could be from bird flu. It's not a matter of if, but when. And the mortality rate will be so high, it will make COVID-19 look like a little pandemic. That is the dire prediction that was made recently by US expert Robert Redfield, a former director of Centers for Disease Control and Prevention. Redfield told a news channel, and I quote, "I really do think it's very likely. It's not a question of if, it's more a question of when we will have a bird flu pandemic." Alarmingly enough, he has also stated that bird flu has a significant mortality rate when it enters humans compared to COVID-19. While the mortality rate for COVID was 0.6%, the mortality for bird flu would probably be somewhere between 25 and 50%, according to Redfield. He says, once the virus gains the ability to attach to the human receptor and then go human to human, that's when you're going to have the pandemic. I think it's just a matter of time. He goes on to say, "I know exactly what amino acids I have to change because in 2012, against my recommendation, the scientists who did these experiments published them. So the recipe for how to make bird flu highly infectious for humans is already out there," he said. Why do we need to talk about this on a priority basis? It's because the earlier the warning of a jump of a virus from animals to humans, the sooner global health officials can take steps to protect people by launching vaccine development, wide-scale testing and containment measures. In the United States, federal surveillance of dairy cows is currently limited to testing herds before they cross state lines. Health officials have warned that the state testing efforts are inconsistent and testing of people exposed to sick cattle is scant. Experts say you need to know which are the positive farms, how many of the cows are positive, how well the virus spreads, how long do these cows remain infectious, and the exact transmission route. Dr. Jean Marazzo, director of the US National Institute of Allergy and Infectious Diseases, has said surveillance for humans is very, very limited. The Centers for Disease Control and Prevention, or CDC, in a statement, though, has said the United States Department of Agriculture and state and local health departments across the country have been preparing for the emergence of a novel influenza virus for nearly 2 decades and continually monitor for even the smallest changes in the virus. But experts point out that some pandemics, including COVID-19, arrive with little warning. In the last flu pandemic caused by H1N1 in 2009, the virus and its predecessors had first spread among animals for several years. 3 people in the United States have tested positive for H5N1 avian flu since late March this year after contact with cows experiencing mild symptoms. One person in Mexico was infected with a separate H5 strain not previously seen in humans and with no known exposure to animals. Other cases have been reported in India, China and Australia, caused by different strains of the virus. The World Health Organization says H5N1's risk to humans is low because there is no evidence of human transmission. Some tools are available if that changes, including limited amounts of existing H5N1 vaccine and antiviral medications like Tamiflu. But other experts say there is sufficient concern to start preparing for potential spread in humans, although triggers for taking action differ depending on the role played in the response. That's what Richard Hatchett, Chief Executive of the Coalition for Epidemic Preparedness Innovations, or CEPI, has said. His organization acted early on funding COVID vaccine development and is now in talks with research partners about H5N1. CEPI aims to create a library of prototype vaccines for pathogens with pandemic potential. This would help drug makers initiate large-scale production and distribute shots where necessary within 100 days of an outbreak. Virologist Ed Hutchison of Glasgow University says, and I quote, "Pigs can get avian flu, but until recently cattle did not. They were infected with their own strains of the disease, so the appearance of H5N1 in cows was a shock. It means that the risks of the virus getting into more and more farm animals and then from farm animals into humans just gets higher and higher. The more the virus spreads, the chances of it mutating so it can spread into humans goes up and up. Basically, we are rolling the dice with this virus," he said. Some countries are already taking steps to protect people against H5N1. The United States and Europe are securing doses of pre-pandemic flu vaccine that could be used for high-risk groups, including farm or lab workers. Finland is expected to become the first country in the world to inoculate fur and poultry farm workers as well as animal health response workers. 14 other European Union countries have signed up to procure bird flu vaccines through a program set up by the European Commission. But expanding vaccine access is complex. Manufacturers of potential pandemic flu vaccines make seasonal flu shots and may not be able to produce both at once. Since most flu vaccines are made using virus grown in eggs, it could take up to 6 months to produce pandemic shots. The US is in talks with Moderna to use their faster mRNA technology for pandemic flu shots. This is a technology that was effective in protecting against COVID-19. Clearly, it's a step being taken in preparation for a possible bird flu pandemic. However, experts also acknowledge a need to balance acting quickly to avert a threat versus overreacting. The question is, have we really learnt our lessons from the devastating COVID-19 pandemic? Are we truly prepared for the next pandemic? Could it be indeed much worse and much more fatal than COVID, as is being predicted by many scientists? How soon could this pandemic come? Could bird flu be the trigger? Are governments around the world making enough investment to deal with the next major global health crisis? How concerned should we be, and what can we do to prepare ourselves?